South Florida lifestyle emphasizes recreation, but sometimes with that recreation, you need a little repair. So with us today, we have two orthopedic surgeons from the Orthopaedic Surgery Associates. Dr. John Van Houten is the founder of the Orthopaedic Surgery Associates, which is in its 27th year here in Palm Beach County. Dr. Stewart Eidelson is a recognized spine surgeon specializing in spinal stenosis and minimally invasive spinal procedures. Glad to have you both with us today. Dr. Van Houten, you specialize in the active adult.
Yes.
Talk to us a little bit about that and what you do.
I do general orthopedics, which is maintaining the structural integrity and function of the body. We deal with the bones, muscles, joints, ligaments, tendons. Since being eligible for AARP some years ago myself, I'm aware of the things that we need to do as we start to get a little older to maintain an active lifestyle and continue tennis and golf and whatever our recreations are.
And I understand non-operative care comprises about 90% of your practice.
Yes, it does. We can fix most things or improve most conditions without going to surgery, even though we are surgeons.
Well, that surprises me considering the age bracket you're working with. Tell me more.
With advances in medicine, with some of the new medications, new treatment techniques, and with a really good physical therapy program, which our practice also has, we can overcome most of the problems without going to surgery.
Are there any cutting-edge alternative treatments that you're implementing right now?
The biggest has been physical therapy. The old standbys of cortisone injections, anti-inflammatory medications, particularly the new ones that have much lower side effects, as well as the technology for minimally invasive procedures, such as arthroscopy of the knee, where it just takes a small wand to put a hole in there and watch it on the video camera.
Now that model that you have right there, the top part is your thigh bone, essentially.
This is the thigh bone, this is the leg bone, this is the kneecap. We would make a small puncture in the skin, put it to a probe in that has a lens on it, watch the whole inside of the knee on a TV camera. We can do most surgical reconstructions of the knee with this, as long as it doesn't need replacement.
Great. Dr. Eidelson, I understand you are an author, and you've published multiple papers, and you have a book, Saving Your Aching Back, A Patient's Guide. Can you talk to us a little bit about that?
Well, one of the things that I've become interested in here in Palm Beach County, there's been a lot of emphasis on activity and maintaining independence in terms of activity. A lot of the seniors work all their lives to come to South Florida to play golf and tennis, and many times they're stricken with many orthopedic problems, either their knee, hips, or their spine in particular. There's a specific condition called spinal stenosis, which is not very well understood nationally, but it afflicts a lot of people here in Palm Beach County. I specifically wrote that book with seniors in mind so that they realize there's a simple, understandable format for them to treat this condition. We at Orthopaedic Surgery Associates treat a lot of patients with spinal problems. And we now have the ability to help these patients get back on the golf and tennis courts much sooner than was previously recognized.
Now, I know you're also the founder of an informational site, spineuniverse.com.
One of the things that we're proud of at Orthopaedic Surgery Associates, we fostered the development of an international site called spineuniverse.com, which has 4,000 pieces of content specifically related to spine and treatments, not just surgery, but non-surgical care, exercise, physical therapy, and chiropractic care. And with this, even the senior population, is the fastest growing group of people using the internet. Besides writing books that we publish and give to our patient at no cost, we also have this interactive site with us. The important thing for us is to educate the consumer and let them know all the choices available to them. It really is a tragedy when they are not educated and don't realize these very rapid programs to get people back up and functional.
Now, I also understand you do a lot of research on the elderly. That's your special interest group.
Well, that became a big interest when I came to Florida because I realized there was a deficit in the amount of knowledge we had in treating people with hip, knee, and spinal problems. So we started a research foundation. Many companies have worked with us, not just on medication, but on minimally invasive procedures that seniors can undergo and have surgery one day and be driving a car the next. The important thing is when a senior cannot shop to drive his car, it puts him in a nursing home category. Our goal is to keep them independent, functional, and have a very positive outlook in the remaining years of their
Well, doctors, thank you very much for this information. Glad to have you here.